Today's video is about the posterior shoulder dislocation. Now come to the first case. A 27-year-old female, gravida 1, para 1, with a newborn boy evaluated on the labor and the delivery floor for the left shoulder pain. She had a seizure secondary to eclampsia 30 minutes prior to evaluation. On examination, her left hand is adducted and internally rotated. Her range of motion is limited due to the pain, and an auxiliary lateral radiograph demonstrates the posterior shoulder dislocation. What are the signs and symptoms of posterior shoulder dislocation? The patient will present with the pain, deformity, and the limited range of motion. On inspection, the arm is held adducted and the internally rotated. So the next case is a 10-year-old female presented with the left shoulder pain after pushing a heavy object. And here is the radiograph of that case. You can appreciate in the radiograph there is a lack of overlap between the glenoid and the humeral head. Humeral head is rotated internally such that humeral head has a light bulb appearance. So what is the diagnosis? The diagnosis is a posterior dislocation of the shoulder. So how will you confirm the diagnosis? You can simply advise the plain radiograph, lateral and axillary view. This is a radiograph, plain radiograph of the shoulder joint with the axillary view. What are the most common injury that is frequently encountered with the posterior shoulder dislocation? The reverse Hill-Sachs lesion, the reverse Bankard's lesion, and the fracture of the lesser tuberosity. So what will be the management of posterior shoulder dislocation? Simply acute reduction followed by the sling immobilization. But there are few contraindications of the posterior shoulder joint dislocation reduction. If the shoulder has been dislocated for 3 or more weeks, particularly commonly in elderly debilitated patient, if the interior humeral articular injury is present, reverse Hill-Sachs lesion, and it involves more than 20% of the articular surface. What's the mechanism behind the posterior shoulder dislocation? Humeral head is forced posteriorly in internal rotation while the arm is abducted. In adults, convulsive disorders are the most common cause. What will be the findings of the radiographs? Simply the absence of external rotation on the images, light bulb sign, trough line sign, loss of normal half moon overlap sign, rim sign, acute angle of the scapulohumeral arch, that is Moloney's arch. So the first picture is showing the trough line sign, in which there is dense vertical line in the medial head of the humerus due to the impaction of the humeral head. And the second picture is showing the rim sign, in which there is a widening of the glenohumeral joint more than 6 mm. This picture is showing the Moloney's arch, in which there is an acute angle present between the scapula and the humerus. What is the significance of this sign? It is used to distinguish the interior dislocations from the posterior dislocation. What are the associated injuries with the posterior shoulder dislocation? Hill-Sachs defect, Bankard's lesion, the proximal humeral head fracture, the fracture of the anatomical neck of the humerus or the lesser tuberosity, the posterior Hegel lesion, the posterior labrocapsular periosteal sleeve avulsion, Polpsa lesion. So here is the MRI film showing the Bankard lesion. The Bankard lesion is the fracture of the inferior aspect of the glenoid labral complex. And what is the Hill-Sachs lesion? The Hill-Sachs lesion is the injury that occurs secondary to the interior shoulder dislocation, and the humeral head collides with the interior part of the glenoid and cause the bone loss or defect. And the last one is the Hegel lesion. What is the Hegel lesion? Humeral avulsion of the glenohumeral ligament is basically an injury to the inferior glenohumeral ligament. In the next video, I am going to discuss the maneuvers for the shoulder dislocation reductions.